Mercuious corrosivus. Mercuious corrosivus has more excoriation and burning, more activity and excitement. Merc is slower and more sluggish. Mer.core is violent and active in its movement, it takes hold and run its course with greater activity. So with a mercury base we have often to prefer this salt. In the eye symptoms there is more excoriation. The pains, burning, smarting, etc., in the eruptions and ulcers are more violent. In Merc, we have slow-spreading ulcers, but in Merc.core, there is great eating, it will spread over an area as large as your hand in a night. He has the mercurial odor and sweat, and he is sallow, he needs mercury, but a more active preparation than Merc.viv. Merc.core has decided symptoms of its own, but they are limited. You cannot tell the tyolism, or the lordaceous ulcers apart. In sore throat, if it is a Merc case, the ulcers are spreading rapidly and burning and smarting like coals of fire, you would say that Merc is not so intense as this. You need Merc.core for the violence, the intense burning, and the rapid spread. The throat is enormously swollen, the gland are swollen, and the thirst is insatiable. In dysentery there is more violence, copious bleeding, great anxiety, can scarcely leave the stool a second, great burning in the rectum. It is a violent case of dysentery. I would prefer Merc in ordinary Merc cases, but if this patient is not relieved he will not live. Merc.core is needed here. In the urinary organs the symptoms are violent. Albuminuria is the more marked in Merc.core than in Merc. It is one of the most frequently indicated remedies in the albuminuria of pregnancy and a very useful remedy when gout is present. From slight irritation of the foreskin of the male organ, the mucous membrane and skin contract and phimosis takes place. Merc.core relieves the itching and burning, and causes the purse string to let up. It is seldom indicated in gonorrhea, but is called for when there is greenish-yellow or bloody watery discharges, with violent burning and urging to urination and to stool, and violent painful erections. Chancres spread with great rapidity. Stitching, rending, tearing pains, here and there, especially in the chest.